You're trying to take care of your health. Maybe you're taking supplements, watching your diet, and staying active. But then your lab results come back, and they don't match how you feel. If you've ever had blood work that seemed off, or even alarming, this video might explain why. Welcome back to Your Skin, Your Health. Today, we're talking about over-the-counter supplements and medications that can throw off common lab tests like your complete blood count, which is known as CBC, or your complete metabolic panel, otherwise known as CMP. Also things like hormone panels, or prostate-specific antigen, PSA, and free PSA. And we can't leave out thyroid function tests like TSH, T3, and T4. Because your health relies on these labs being correct, you deserve accurate answers, so let's break it down. Let's start with one of the most common offenders, biotin, also known as vitamin B7. It's marketed for hair, skin, and nail health, and often found in doses of 5,000 to 10,000 micrograms. But here's the issue. Many modern lab tests use biotin-based technology, and too much biotin can distort those results. This includes TSH, free T3, free T4, which are thyroid function tests, and your PSA and free PSA, as well as estrogen and testosterone. Biotin can also affect some cardiac markers like troponin. Biotin can create falsely high or low readings, making it look like you're hyperthyroid when you're not, or vice versa. What to do? If you take biotin, stop it 2 to 7 days before lab work, depending on the dose. And always consult your provider. Even small doses can matter with sensitive tests. Next up is non-steroidal anti-inflammatory drugs like ibuprofen, Advil, naproxen, Aleve, or even aspirin. They're common and helpful, but they can affect several lab values. They can potentially lower platelet counts in a CBC. They can possibly elevate your liver enzymes, and they can adversely impact creatinine and kidney function on your metabolic panel. And they can even falsely lower the PSA readings in men. They don't always cause problems, but if you're taking them regularly or at high doses, they could influence your results. So, what can you do? Be honest with your provider about how often you take them, especially before a PSA or kidney panel. Antacids and proton pump inhibitors, PPI, things like Tums, Pepcid, Prilosec, or Nexium, are also surprisingly influential. Long-term use can reduce absorption of magnesium, calcium, vitamin B12. These deficiencies can show up in your electrolyte panels, CBC panel, like anemia from low B12, and even nerve or hormone-related symptoms. What you can do? If you're on these regularly, be sure to let your provider know, as they may want to check nutrient levels more often and adjust testing methods accordingly. High-dose vitamin C, like what's in immune boosters or chewables, can interfere with creatinine readings, urine tests, and blood sugar monitors. Why? Well, vitamin C is chemically similar to glucose, so some tests can't tell the difference. So, it may falsely lower or raise numbers, depending on the method used. What can you do? If you're taking high-dose vitamin C, let your provider and your lab tech know prior to getting your blood drawn, as they may use a more accurate testing method. So, you are working out at the gym? Great, but did you know taking creatine or lots of protein shakes can alter labs? These products can elevate creatinine, BUN, otherwise known as blood urea nitrogen, and impact your estimated GFR, a key kidney function marker. Here's the catch. Your kidneys might be perfectly fine, but the lab sees high creatinine and thinks there's a problem. So, what are you to do? Always tell your provider what you're taking, as they may interpret your results differently or order a more specific test. Now let's talk about DHEA and hormone-related supplements. So what does DHEA do? DHEA is a hormone precursor that converts into testosterone and estrogen. It's sold as an anti-aging supplement, and it's also in many men's performance stacks or testosterone boosters. But here's the problem. DHEA can raise the PSA level indirectly by increasing DHT, which stimulates prostate cells. It can elevate testosterone or estrogen levels, and it may interfere with free PSA interpretation in men being screened for prostate issues. So, what's a high dose? For most men, above 50 milligrams per day is considered high. While some men take 100 to 200 milligrams per day or more, that's when lab interference is more likely. So, let's not forget about herbs, as they can also influence common labs as well. Take saw palmetto, which may lower DHT and PSA. The herbs tribulus and tongkat ali may falsely boost testosterone levels. And black cohosh and dongquai can have estrogenic effects. What should you do? Always disclose DHEA, or hormone-acting herbs, before hormone or prostate testing to your healthcare provider. In fact, you should give them a list of all your over-the-counter meds and herbs you take on a regular basis. All right, so that covers a big chunk of the OTC and supplement side of the story. And as always, at Your Skin, Your Health, we're here to help you feel informed, not overwhelmed. So, always talk with your provider before changing up your supplements, medications, or health plan. So here's the bottom line. You know how your body feels and acts, so if your lab results don't match how you feel, look closely at your over-the-counter meds and supplements that you take. They don't have to be harmful to cause confusion. Sometimes it's all about timing. Sometimes it's the dose. But most of the time, it's just about communication. Bring a list, tell your doctor, ask if your supplements might matter, because good healthcare starts with good information. If this helped you feel more informed, give it a like and consider subscribing. And share this with someone who's doing all the right things but still getting confusing labs. I'm here to talk real solutions, not trends. If you're taking prescription meds, especially thyroid, statins, or steroids, don't miss my next video on how those can throw off your labs too. Stay strong, stay healthy, and stay tuned to Your Skin, Your Health.